National health experts say there are no known medical conditions that make vaccines unsafe, except for a few very specific severe allergies. Greensboro employment attorney Nicole Patino says that's the only type of exemption approved by employers she's seen. Again, a potentially life-threatening allergic reaction to the vaccine. Since it's up to employers to decide who gets a pass, there are other factors they should also consider.
Only if the employee has had anaphylaxis in response to a previous vaccination. Other than that, employers are saying we don't want to take the risk because they do face some potential penalties if they have an unvaccinated workforce and there is its spread of infection.
Those penalties she's talking about go back to President Biden's requirement that workplaces with more than 100 employees must either vaccinate their staffs or test unvaccinated workers once a week. She says healthcare jobs are a good example of a field where accommodations like weekly testing for the unvaccinated may not go far enough.
So it may be too high a risk for them to allow unvaccinated employees, particularly if they have a large number of employees who are requesting these exemptions to maintain the workforce and the safe work environment for both employees, patients, and whoever else comes into the facility.
Of the 35,000 people who work at Novant's many hospitals and clinics in the Southeast, about 175 were fired for not getting the shot. So the vaccination rate at Novant Health is 99%. Patino says other employers are seeing mixed results among their employees.
Some employers are having good success rate, but there are lots of employees who are quitting and who are being fired because they have concerns about the vaccine. And those concerns typically extend beyond religious or medical concerns.
Patino says OSHA fines are possible for workplaces that do not comply with federal law on vaccinations.